Okay, I think Papilocare works as a whole. You can pinpoint a specific effect, that it's the main effect. I mean that all three effects, the reepithelialization, the betterment of the microbiota, and the improvement of the immune system, all is a continuum, all is a whole, and you can't separate one from the other. And I think the three effects potentiate themselves to give the final results. So you shouldn't point out one in front of the others. And I think we should take into account every one of them for the whole evaluation of the effects of the treatment. Okay, that's a very interesting question, because there is a pool of patients that you actually can't treat aggressively. So you must conform with just wait and see. That's the women who had low seal lesions or HPV positive women. And so the only thing you could do up to now is tell them not to smoke, to have a healthy life, and to check out every 6 months or so. Now we have a tool that can actually do some good on taking out the HPV from their system. So that's very important, and that's a very good improvement in the way that we were doing things up until now. Okay, now we are using Papilocare on this regime. We try to give on the first month 21 days of Papilocare, and from the month 2 to the month 6 we do every other day those 21 days, and the results are really interesting, and they represent a cornerstone to grow on, and to do some more research and try to find out if a higher dose regime is going to help us in the healing of those patients with HPV positive virus.
Personally, I don't use the cryotherapy. I prefer the loop excision, and if it's the need for the ablative therapy, I go for the laser, but I know that the cryotherapy is still in market. And we have the good positive feedback from doctors using the cryotherapy, yes. In my practice, I use the Papilocare after the loop procedure, at least in the period where the woman stops bleeding. And I do it for the 1 month, I mean the 21 days every day. And if the woman appears for the recheck for the results, and we know for the population study that the test of cure is the HPV infection. If there is no HPV infection, there is no need for treatment. But if there is the HPV persistency, we know that this is the highly dangerous risk factor for recurrence. We advise the woman to go on for the Papilocare for additional 5 months. Yes, I do it. Well, Papilocare could be beneficial for women diagnosed with HPV positivity with no cervical lesion, as we know. This is the population of women which are at risk of developing the precancer, and also the women which already developed the LCIA or ASCUS, I mean the lower cytological abnormality, especially in those women which are high-risk HPV positive, I mean the alpha species, high-risk HPV 16, 18, and others. And of course, additional group of patients of mine which benefit from the Papilocare and local immune modulation factor are women after the colonization of definitive treatment of high-grade CIA. But the main group would be the women which are referred for the repeating cytology after 6 months and 12 months. If you look for the chart of the screening national guidelines, for instance, in our country, if we diagnose women with ASCOS of LCIL, the option is to repeat the cytology within the 6 months. And these are the excellent candidates for treatment, because it's really hard to say to a woman, okay, please refer for the repeat test after 6 months. She will be nervous. But we need to have the core data coming from PALOMA 2 study and other studies, which will produce the result from the placebo control groups.
The Papilocare could be used as a prevention in HPV positive patients or in the patients with mild dysplastic changes of the cervix, like low-grade squamous intraepithelial lesions or the ASCOS cytological category. So it could be used alone or with the combination of other treatment modalities. So it can be used solely, also in the combination. According to the PALOMA study, the Papilocare is effective on any type of HPV infection, even when the research was focused on the high-risk HPV population. So we observed the global and general effect on the HPV virus infection.